So to clear up the video, we'll start where it left off. We'll start on 95, page 95 in your book, okay? We talked about the special considerations for not to do a venipuncture through scarring, the mastectomy, it's gonna be one of those days. Mastectomy, right? You don't want to punch through a hematoma. That sclerosis, if you feel the vein that's hard, remember the vein's supposed to be bouncy and sort of movable. Otherwise, it may be a tendon. This is important information, like on the tourniquet, the 3 or 4 inches above. All right. Where you place the tourniquet, probably the most important thing in there is the one.
Teachers, make sure that we are counting parties this morning. A lot of people strolling in lane. Make sure that we're holding them accountable, being on time. Thank you.
If you don't have a tourniquet, for some reason you can inflate a blood pressure cuff for a minute. So the vein's still the same. We talked about how the vein feels. Make sure that you practice on yourself. All right, feel that vein. Or your parents or whatever, friends, just palpate that vein and then find a tendon which is off to the side, that anacubal space, and feel that tendon and feel the difference in between the two. Okay, you sort of have to train your brain to do that. Remember, when you put the alcohol on to clean the side, you need to leave it on there and let it dry. Everything has a dwelling time on it. That's what people don't understand with these wipes and everything. I saw it just the other day. They wiped this surface down with the Clorox wipe. It was here. They wiped it down, and then they came back across it with a paper towel and dried it. So they just wasted that Clorox wipe because they have to leave it on there. Every substance to kill bacteria and germs and that has to have a dwelling time. So we need to leave it on there, and we obviously wouldn't blow on the side, right? You know, but, or touch it after we clean it. The insertion of the needle is still the same. Okay, remember this transfixing. I need to remember that because I didn't even know there was a name for it. But where you blow the vein, or you go through, you puncture through the top and bottom of the vein, or you might puncture out to the side. Remember, it's a round tube. You're putting a round tube into, so it's not that hard. The actual venipuncture is not that hard. Do remember the angle. That's a definite on the test question, perhaps. Okay. Too shallow, especially in the dorsal hand. It's superficial, so you have a possibility of hitting a nerve there. So be careful on the different angles. 22, 23 gauge needles, okay. It says 21 is the most common gauge, and that's probably about right, okay. Because if you get the needle too small, like if you go towards a 25 or 27, you can cause the red blood cells to break apart. Hemolyze, right? Is that the word? Okay. So the additives in the vacuum containers. I talked with the phlebotomist yesterday about this, and they don't know. I confirmed my suspicion that the person who earns a living drawing blood doesn't know the additives in the containers, right? And they don't need to, like we talked about before. The MLT does, all right. You need to make sure it has a vacuum and it's sealed and the labels are good and it's it's not expired. But, however, for the test, the PCT exam, you need to know at least this. I would memorize these, okay, because it's in your study guide. So you do need to memorize like a light blue, sodium citrate, coagulation, you know. So do memorize these. I think the last one was maybe what's in alcohol, but we'll go over that. We'll have it in our notes later. It repeats the processes of the needle, the vacuum container, the syringe, right? It's all a venous puncture. So don't leave the tourniquet on for a minute, more than a minute. You know, the procedure is actually all the same. With the syringe, it's the same method. Okay. Everybody good? The thing with the syringe, remember that we don't want to pull it out too fast. If you pull it out too fast, it can against the wall of that vein. So if you're not getting a flash or the blood slows down, you can move the needle slightly to see if it's up against that wall. If it's up against the wall, it won't. Or you might be right up against the valve. So if you're right up against the valve, it won't flow. So you have to pull it back. You just have to be careful not to pull it back where you actually pull it out of the vein. You'll know that really quick. All right. Oh, that's a hematoma. Yeah. Okay. So be cautious of that. Make sure that you get the air out of the syringe. The angle's the same when you're drawing with the syringe, so that's no different. You just don't want to have air in there, right? Causing that nasty little air embolism. All right, so I think we're caught up now. So we'll go to the non-blood specimens. I don't know, this comes up here in a minute, but I'm going to go ahead and talk about it. It's somewhere in here, I'm sure.
Page 92?
The order of draw. Okay, well, the non-blood specimens is on 102, but the order of draw. So there's an order of draw, and it's in the book somewhere. We'll find it as we go through it. Memorize their order of draw, okay? Because they're the one that's testing you, right? So memorize their order. I'm not sure if it's the same order of draw as this. This is a little memory jogger I put up there. I don't, stop, light, red, stay, put, green, go. Okay, it's just easier probably to remember the tubes in the order because it's not universal. Okay.
Oh, it's on 114.
114. Okay, is it the same as that picture?
No.
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 Okay.
No, it's like we were separated before and
All right, let's do this then. Okay, so disregard all that. Memorize the order of draw that's in the book. All right, because it's not universal, so they're testing you. So memorize their order of draw. Most of them say it doesn't really matter, but anyhow, it does for the test. Okay. So non-blood specimens, we'll start with urine. Okay, there's all kinds of blood specimens that you will gather. You will not gather anything as a PCT that is sterile. So through a Foley catheter, unless you're trained in sterile procedures at a particular hospital or doctor's office, okay, you won't gather sterile procedures. That's for the doctor to do or the nurse to do. So through a urinalysis, through a urinary catheter, you wouldn't do that. Okay, because it's a sterile procedure. Most PCTs don't do sterile procedures. Okay, amniotic fluid, cerebral spinal fluid, like through a spinal tap, the doctor's right there. He's gathering that. Now he may hand it to you, or the nurse may hand it to you for you to label and take to the lab, right? But you won't actually draw that. But nobody likes drawing urine specimens, right? I saw a little badge the other day on a text thing. It said professional urine handler or something like that. Because you draw so many urines. The abundance of people that come into the emergency room, for sure, even in the doctor's office, they pee in a cup because the urine tells you so much. Okay, they might just dip the chem strips in it, okay, or that's something that you would do if it's a chem strip and they're dipping the urine, maybe for pregnancy or glucose or something like that. That's something you do. So you would take the urine and dip the stick in and record the colors changes on the strip, okay. Otherwise, they're sent to the lab and they do it. They do the procedures, okay. It's not it's very common sense that you would use gloves, right? You know, someone hands you a urine specimen, you probably want to have gloves. So wear gloves. Make sure that you would give the instructions, okay, and make sure that it's sealed tight and that there's not any urine on the outside. You put it in a small biohazard bag. That if it's in a cup, then you wouldn't transport that in a tube system. You would carry that down. It might spill. It might come open. There is a urine collection that you would do a vacuum tube to. So you would have the urine cup and inside the urine cup is the covered needle, just like the vacuum cleaner, and you push the tube on top of it and the urine would come up in the tube. Now you can transport that in a tube system because it's sealed, okay? But a cup you can't transport in the tube system. In the lab they may do a culture on it, so they'll take the urine, put it in a little petri dish and see if there's bacteria in it. They're trying to grow some microorganisms, okay, to see what it is. Usually they don't need a lot of urine to do the test, they just need a little bit, but each test will have a different volume of urine that they will need. Unless the patient's really dehydrated, a lot of times they don't have trouble giving the urine specimen. If they really need it, or if the patient's unconscious, then they would do what's called a quick catheter. They'll just put a catheter in real quick, get the urine, and then pull the catheter out. Perhaps that way. And most of them are clean catch, so you would have to give them the instructions that, hey, do the proper cleansing, cleaning, wash your hands, do the proper cleansing, cleaning, and then urinate a little bit in the toilet, and then urinate in the cup. It's a midstream, so they want that. They sort of the best part of the urine, right? If there can be a best part of the urine. So, and then make sure they don't touch the inside of the cup. The cup, once you take it out, it's in a sterile package. So you take it out, you don't want to touch the inside. It may affect the test, especially if they're trying to grow it for microorganisms, right? So you don't want to touch that. So you have to give some instructions for that. Some of them are random, like drug testing. You go to these different sort of, I don't know, they're mostly like workman comp places. Like if you get a job, they send you over to this place, you get a drug test. If it's not in a hospital or whatever, they'll send you over there, and they just do the drug testing, okay, or the labs. Anyhow, so that's another part, and that's another job that you'll be able to do. Be a tech over there where you draw labs and urines all day. Doesn't seem like my really cup of tea, but job is a job, right? Starving college student. What do you do? What do you do? Well, draw urine all day. Hold other people's pee all day long. But there is a lot in there. Sometimes they send the first urine in the morning. This means that you go to their house and wait for them to wake up. You're standing by their bed waiting for them to wake up. Hey, wake up. You give them the specimen, they go home. You still give the instructions, the same instructions on what to do. If they can't get the urine back to the lab within an hour, they're to refrigerate it, okay? So sometimes it has to be a fasting urine, depending on the test. Okay, so if you're working at the doctor's office, doctor says, okay, I want a fasting urine, they give you all the supplies, and then the first urine in the morning, you'll wake up and go do that, okay? Some of them, like these time specimens, or to test kidney functions, okay? How much creatine, let me see, I wrote this down, proteins, minerals, they do it for diabetes, hypertension, frequent UTIs, so if the patient's having multiple UTIs, that's something that they will do. They will, over a period of time, 24 hours, they're going to collect urine, okay, to see what the problem is. More than likely, you have the patient has a microorganism in there that keeps reoccurring. Something's taking place where they're not necessarily, they may not be taking all their medicine or something, you know. The other instructions that you would give them to make sure that they don't mix poo with urine, and until you get used to it, these are probably sort of awkward conversations that you have with people, you know. Hey, when you poo, don't mix poo and urine together, okay? I mean, but once you get used to having the conversations and giving the instructions,
They poo in the cup.
it's second nature, huh?
They boo boo in the cup.
No, they don't want that in the cup. You want urine in the cup.
But they boo boo in the cup.
They mix it. Yeah, they might mix it together somehow. Okay, because the container is larger container. So you just want to make sure that you tell them, hey, don't mix. We want just urine. Okay, because these time specimens are over time. Okay. Anyhow, so look at that. Glucose, you know, they have to confirm that the patient is fasting glucose. It doesn't do very much to draw glucose and they're not fasting. Okay, usually 12 hours. So that's like one of the questions might be, hey, you go into the room, you're to draw this fasting glucose, okay, and you notice that the patient's food tray is empty, right? So you know they have to be fasting for 12 hours, so you would ask them if they ate, and then report that finding to the nurse, right? But you may have to come back in another 12 hours for the glucose test. How do you say that? Postprandial? Yeah, okay. That's right after you eat, okay? So this is a tool that helps for, to track their insulin, so you make sure if they're taking the proper insulin or on the sliding scale, or to confirm diabetes, okay? And we just talked about the clean catch midstream collection in there. It is important to make sure that they understand the instructions, okay? In reality, you probably don't need to give them instructions every time. You know, you hand them the cup and say, are you familiar with how to do this? Yeah, got it. You know, and then you can sort of bypass the instructions, but make sure that they're familiar and tell them to make sure that they follow the instructions, okay? And then the sensitivity or culture, they do this midstream for the bacteria, okay? The process is the same. It's just a matter of when you get it to the lab, how they handle it. But hydrogen peroxide, never use alcohol. Hydrogen peroxide or iodine, it can hurt the results of the test, okay? So, many different things in this. How would you say that? Reagent. Okay, strip, or the little chem strips. They're just chem strips. They change colors when you dip them in the urine. There's a lot of different tests, as you can sort of see down through there. I wouldn't necessarily memorize these different values for these. I'd just be sort of familiar with them in the test that they do. White blood cells, hemoglobin, the density of the urine, okay? If the density is high, then you're concentrated, and you can usually see that urine, concentrated urine is discolored. you know, it gets really yellow or orange, okay? And you would have to document the color of the urine, all right, when you get the specimen. But most of the time, if the urine is really concentrated or has a high density, the patient's dehydrated. Okay, that's the most common thing that takes place. But I wouldn't be too concerned with the numbers. Just understand what the tests are. Okay, they're looking for alkaline or acidosis, right? In diabetes, they might be looking for ketones in the urine. Otherwise, the ketones are passed through the urine, and hyperglycemia, DKA, those type of things. Okay, a lot of vomiting. Proteins can be passed through the urine. They're not supposed to be, but they can be, right? So these are the things that they look for in the for the strips, and in the other test. Okay. I don't know if it's true. I didn't really care enough to do any more reading about it, but they said, I read this one thing. They said it takes days to pass all the stuff, the chemicals that are in the energy drinks, like the Monsters. I think it was like 3 days. Anybody drink Monsters or that stuff? Red Bulls?
Once in a while. So
Yeah.
like not regular.
Yeah, it takes a lot to pass, a lot of water to pass that through the kidneys. They're just saying, hey, if you do drink these energy drinks, follow it up with a lot of water, okay? Because it damages the kidneys if you don't drink the water with it. You know, some people live on those energy drinks, man. They drink it like water, and they are damaging to the kidneys. They have a lot of stuff in there that is supposed to be burnt up, used up, you know. Anyhow, so be just a side note on that. I sort of thought of this when I said, man, that's a lot of water. I mean, it's like a gallon of water to flush out one energy drink, which is a lot of water to drink in a day.
Is it the same thing when you do drugs and stuff like that?
No, it's just on the way that they're metabolized. Like drugs sometimes are stored in fat cells. Why are you asking?
It's because like
She wants to be safe next time.
no, no, it's because like I know people that are like, oh, if you do this, like drink a lot of water and it'll go away faster or something like that.
No,
Oh, yeah,
no. Like marijuana is stored in fat cells, so don't go away with water. Okay, it just depends on how it's metabolized and how it's stored. So, saliva specimens, yummy. Okay, alcohol, hormones, drug levels. So you take a lot of times they do a little cheek swab for the drugs. You go in there and do that. They'll do that at the laboratory. You just want to make sure that you do a good, nice, well, the cheek swab is coming up here in a second, but saliva, you know, they want you to take saliva samples or sputum specimens, okay? Sputum is this is probably something I would dread to do, but as you go through, especially with respiratory, they may be going to take sputum samples where they have the person try to cough up or expectorant, okay, little vocabulary word for you, to cough it up, all right? So if you have a lot of mucus or phlegm, you want to cough that up, you know, like a Mucinex. That's what that's for, to break that up. But they'll want to try to have the patient cough that up so they can take it to the lab and run the test on it, okay, to see if there's a little bug growing in it. And most of the time, if it's discolored or something, there's a microorganism in there, so they'll do that. There's procedures, you know, hey, don't use any mouthwash or eat or drink anything, or spit saliva in. Y'all understand the difference between saliva sputum, right?
Mm-hmm.
Okay, sputum comes from the lungs, and the saliva is just spit. So they don't want to mix any of that in there. They don't need much, okay? Just a couple teaspoons, whatever a teaspoon is, you know, about a teaspoon's like 5 milliliters. So they don't need a lot. They just want you to cough that up, and so they can take it to the lab. And the procedure is still sterile. You want a sort of a nice sterile environment inside the cup and everything, so you don't affect the test when they do that. Let me see. And you'll see, a lot of times respiratory will do this. They'll go and try to get that person to cough it up. I don't know if you've ever been to the doctor before, that like when they say, hey, can you cough that up? You know, they'll give you like a 4x4 or something. I have, you know, which they said, can you cough, if it's productive, you think you can cough that up? I'm like, I don't know. You know. Anyway, most jobs is PCT. This is your motivation to stay in school and become nurses and doctors, right? So you don't have to do this, especially the next one, because nobody likes stool specimens. If you like to draw stool specimens, you need help.
Ew.
You need help, okay? But trust me, in medicine, nursing, whatever, you think, oh, I'm not going to do that. You will. You'll do that as a nurse, as a resident. You're going to do it, okay?
Fun.
Yeah. Woo. Yeah. On my way to be a doctor, great. Get a stool specimen, parasites, blood, okay, different things. Someone that has like a really bad diarrhea, you know, they can't stop it. You know, a lot of times they feel good. Okay, they don't feel really bad. They just have diarrhea, right? And so that sort of a sign that, hey, there's probably a parasite in there, because whatever the body doesn't want, it's going to reject it. Okay, if it's up top, don't throw it back up. It's already in the lower GI tract, don't poo it out. You know, I mean, that's simple, but that's really the way it is. So they look. The most common test, they look for blood, for like GI bleeds and different things. Maybe a cancer or something would cause a GI bleed, which is the second worst smell in the world. I don't know if you've come in contact with.
Yeah.
Oh,
What's the worst smell?
a perforated bowel. You'll never forget that smell. Okay. So a fungi, a virus. When you go through your studies, you'll take microbiology. Most everybody will take microbiology. And so you'll learn about these fungi, these viruses, these parasites. I'm telling you, micro will make you itch for a semester. I itched for an entire semester. It's like, because they're everywhere, you know. Some are healthy, some are bad. Some are indifferent, you know. Some will kill you. So I mean, you're sitting there going, man, I got took out by a microorganism. Wow, great.
It's not fun.
All this life, I got took out by a microorganism. Okay, but anyway, what you need to do is they'll give you what's called a hat, and it looks sort of like a hat. It's just this thing that sits over the toilet, and the patient will go sit down to do his business, and they don't want urine in it, they just want stool. So the hat is sort of half, so the person can urinate into the toilet. Here's the fun part. So they poo into the hat, and then you go get the hat, and with the you know, not with your finger, like, but you get a tongue depressor or something in your cup, like a urine cup, and then go scoop up some poo and put it inside the cup.
Wow.
And you want to be cautious of making sure that you don't you know, the tongue depressor, it's an aseptic technique. You just touched it with non-sterile gloves, so it's not sterile, but the tip of it hasn't been touched, right? So you dip the tip in the poo and then into the thing. So it's a system where you don't want to necessarily do a non-aseptic technique. Yeah. Everybody's going, oh, but you're going to do it. I think I can almost guarantee that, how many of you guys want to be nurses? Yeah. I can. Yeah. What anymore? Yeah. Well, just wait, docs. You get the next test. So you, either way, these are things that definitely people don't like enjoy. And think on the other side of this, the patient doesn't enjoy it either. Okay? So, anyway, you don't need much to transfer inside, okay? You don't need a lot of stool. They look for the parasites and different things. Some samples can be refrigerated, but that depends on the test, okay? So in the instructions, they're going to tell you what to do. The good thing about it is once you get it in the cup, you seal the cup up and send it on. Just think of that poor lab technician that, you know, has to grow those things. All right. The other things that they will do is for looking for blood and they did this just the other day with that patient that they did CPR on. They were looking for blood, right? They put the doctor will glove up, obviously, get a little lube on his finger, and then go up the rectum and find a little poo and pull it out and put it on a card, little card, and then it will change colors. Okay, they'll do that if they suspect a bleed or in trauma. Later, I'll tell you about the Parkland handshake. If you go to Parkland or Baylor or any trauma facility and you're a trauma patient, expect them to shake your hand. Okay, because they will. I'll tell you later. Everybody's going.
I'm not shaking
Certain fertility clinics and different things may call it semen specimens. It's the same procedure, okay? Just a different sample, okay? Sperm, they do it for like sperm counts and to see who's the daddy. Anyway, throat swabs. You'll do a lot of these if you work in a doctor's office or over in fast track. You see them, especially this time of year. If you go into the doctor now, they're going to swab your throat and they're going to swab your nose. See if you have strep or flu, right?
That feels weird in there.
So on the throat swabs, you have to go back there. All right, wear the mask because they may cough in your face. You have to go really back. Most everybody's had their throat swabbed, right?
Yeah.
Okay. So you go back to the tonsils and right around that tissue, especially if you see pus pockets, you want to sort of swoop over that, okay? And you have to go back in there. They get a lot of false negatives on throat swabs because they don't go back far enough in the hypopharynx to actually swab the throat, right? Most everybody gags, you know. I can't stand it. I like I don't mind the nose thing, but man. But make sure that you go back through there, wear a mask, make sure your hands are washed, you got, you know, gloves on, good aseptic technique, and you will need to wear a mask when you do this, right? You don't want them coughing in your face. So stand to the side if you can, but if you can't wear a mask, and then you're protected from the droplets. Buccal swab is the throat swab. B-U-C-C-A-L. It's pronounced buccal, like a buckle, belt buckle. Okay? I asked Google. And so how to pronounce that. because with the two C's there, you're going, huh, what is that?
Buccal.
Buccal, but it's pronounced buccal in the throat. It's just like to do DNA tests, different things like that. So not a lot really in there. Okay. So blood cultures, these are a different animal. So you go and you're doing a venipuncture, okay, and you need blood for the cultures. So they're going to, there's an order which they tell you on the bottle what order to draw them in. Okay, so you would put blood in here, and there's an exact amount that you would put in. You don't want to put in too much or too little. They're going to take these back and then grow these in the lab. They're going to put them in a dish and try to grow something. Okay, so one really good test question on there is you used to clean the top. So you pop the top off of the. If you get the chance in the hospital to see them do this, okay, that way it reinforces this. But use the 70% alcohol on there. Okay. But you wouldn't use on the skin. You would use the iodine, the chlorhexidine gluconate or chlorhexidine. Okay, you would want to do the skin with the chlorhexidine. That way, remember, alcohol just sort of moves the germs around a little bit. I mean, when you're talking about a microbiology, you want that no germs there, correct? So this chlorhexidine will kill those germs. It's like raid in a roach, right? Germ is dead. Okay, but you wouldn't use that on the tops of the bottles. That was a test question.
So you wouldn't?
You wouldn't use the chlorhexidine on the top of the bottles. Okay, you would use the alcohol to clean off the tops of the bottles. You want everything as clean as possible. Okay, when you draw these in the certain order. Okay, it's the same as a blood draw, okay, but in the blood draw, it's in a certain order. So you would do these first. So if you were to draw cultures, you would draw these first, okay, and in a different order. Most facilities require that you draw these in different veins. So you're going to stick the patient twice. So your first draw, you can get the blood for the number 1 vial, okay, and then go ahead and get the rest of your labs. Get the rainbow, if that's what you're drawing, more than likely, okay? And then you will have to stick the patient in the other arm or another vein to get the second one. All right, so they're going to get stuck twice.
Sheesh.
So no big thing. And then you, once you get all this done, just like any venipuncture, then you would put a bandage over it, adhesive bandage. I remember what they call this now. I put this out for a reason. Remember the other day, it's like, I can't remember having that little old moment. They call it Coban.
Coban?
Coban. So they say, hey, go get some Coban. This is what you're looking for. Anyway, it's self-adhesive. So when you wrap it around, it's like cling. It sticks to itself a little bit. Okay, it's very useful for that. And you would pull that tight to make sure that they're almost too tight. And just tell the patient to leave that tight for several minutes, okay? Unless their hand starts going numb or something, turns blue, then that's obvious, right? Hand turns blue, you might want to loosen that up. Anyway, it's called Coban. Alright, so almost done, I think. Yeah. Hemostasis. Stopping of the blood flow, just a vocabulary word. I sort of took that out of order. But adverse reactions to the blood collection, okay? To prevent a hematoma, you want to make sure that you have adequate pressure on there. The hemostasis is the stopping of the blood flow for some reason, okay? Keep in mind, especially in the elderly, that the skin can tear really easy. They can get skin tears. As a patient gets older, the skin gets thinner and it tears, okay? It's not like a laceration, it's a skin tear, which is really hard to treat. It takes a lot of time to treat these skin tears, so you want to be very careful. Some patients have big old hairy arms where you're drawing the labs at, right? When the tape comes off, it's like waxing, you know, right? Other things to look out for is you're about to draw a lab or you're drawing lab and the patient starts to get real pale, diaphoretic. What are they about to do?
Pass out.
Pass out or throw up, right? So somebody has these reactions to needles. You know, make sure that they're sitting up or laying down so they don't pass out and hit the floor. Some of them may become short of breath, but it's usually hyperventilation, right? They start to hyperventilate because they don't like the needles. All right, get short of breath. So you have to sort of talk them through that. You know,
What would you do if, like, let's say you're putting a needle to a patient and then they like had a seizure? Do you pull it out or do you just leave it in?
if it's tonic-clonic seizure, probably pull it out
Okay.
because it's just don't go everywhere. Just get the blood when they're postictal.
Okay.
Yeah. Nerve damage, it says it's rare, but you do have nerves along the side of those veins. So if you do hit a nerve, and we talked about this before, you hit a nerve, the patient is going to tell you, hey, that really hurts. Believe them. Okay, withdraw the needle, stop the procedure, go to a different vein. And then just read through the vocabulary. We're familiar with hematomas. Phlebotis is just an inflammation of that vein. Okay, phlebotomy, flea, the P-H-L-E, right? Yes, would mean blood draws, right? Veins. Petechiae is just a little hemorrhage. So if you see petechiae, little spots around this, the place there, that's another adverse reaction to it. Dizziness, syncope. So you can read through there. Seizures is on the back page there, so you would definitely stop your blood draw after that. So, handling and transport, you guys have any questions? Going good? I don't think this is too fast for this. It's pretty easy stuff to understand. So some of them are time sensitive, so you need to make sure that you get them to the lab on time. Some of them need to be protected from the light. So you'll know this because in the instructions, in the order, it would say, hey, protect this from the light. So you would put it in a special bag or wrap it in something to protect it from the light. Okay? A lot of things, if there's too much time, a lot of the tests, if there's too much time in between the draw and the actual testing, it's going to alter the exam or alter the test. Exudate, E-X-U-D-A-T-E. I didn't ask Google on how to pronounce that. But in all the vocabulary, just like we talked about before, you have to know the vocabulary. So these sort of massive cells. So I bring that up just to sort of see, to make sure that you do understand the vocabulary. Document, if it's an issue of chain of custody, which everything is, okay. So if you take something into the lab, I mean, if you did the draw, your initials, time, and date are on there, okay, already. But most of the time when you go into the lab, there's a little time clock or there's something there that you sign this specimen into the lab, or the hospital I worked at, you took the order and you had a little time clock there. You put it in there and it time stamped the order when it was at the lab. Okay, then you left the order in the biohazard bag. Okay, so everything sort of has a chain of custody. If it's a criminal thing, if it's a something that's law enforcement related, then you definitely need a chain of custody. So if I come up here and I give it to you, then you would sign for it. That way we know who has handled this specimen, whatever it is, right? It's like a lactate. You may have already seen this, a green tube, I believe it is. You put it on ice, okay? So they need it on ice. Some they need at room temperature. Some has to be refrigerated, right? So it just depends on what the test is, on the time and the temperature and how they handle the specimen. There's no reason to memorize all that, you know, because it's going to be on the instructions. Now, I probably would memorize something like a lactate on ice or things, but we'll look at that when we actually do the review. But do think that they need, some have to be on ice, some don't. It says here an ammonia and lactate must sit in ice. So since it's in here, then that I would memorize that, right? I've never seen the bilirubin or folate where they wrap it in foil, but I'm not around a lot of these. So just read through that. Time, glucose is always time, because the cells are going to, the glucose, once the cell's out, it's going to, the glucose is going to break apart. So make sure what we talked about, we label everything, the date, the time, your initials, time of the collection. There's no problem about wearing gloves when we collect urine, but do keep in mind that, like we've just been talking about, that you just can't leave it sitting there all day, right? So whatever the preservatives are or in the cup, it requires the timing on it. The pneumatic system is that tube system is just like a bank. You know, you put in the tube and you push the button and it takes it away to wherever it's going to go. Okay. Some, like if at a doctor's office, they may have a courier come pick it up. And then, so if they do that, then definitely chain of custody, that the courier would sign for it, and you would release it where they transport it in a vehicle. And some of them even, they don't like to be shook up, so you might need to transport them in your cart where they're upright and they're not shaking. Okay, so like I said, it just depends on the test. Remember this Clinical Laboratory Improvement Act, those are the guys, that's the government agencies that hand down the government standards for laboratories. Okay, so they're the inspecting body. You'll see this in the ER all the time. So they'll go like the glucometers and the different measurement devices there. They'll go in the lab, it's over there testing them. Okay, they test them I think every day. They test the machines. They come through and do what would you call it? Where they test to make sure that the accuracy of the machine. Huh?
Inspection?
Yeah, the inspection. They want to make sure that the machine is working properly. Okay? Especially the glucometers. In here, over in the next page, when you have a glucometer and you run out of the strips, or a brand new glucometer, right? Then you would run test strips through there to make sure that it's performing the way that it should be. There's a word for it, and I can't remember it. You run these controls, so you have control solution, and you run the control solutions through there, okay? And usually that's after every time that you change strips. So you enter the lot and then you do the control and you make sure that the glucometer is working, functioning normal, okay? Sometimes, let me read through here, that's usually done at each day, but sometimes they require that you do this each time, okay? So what you do, especially not like the little glucometers that we have here, like the hospital glucometers, what they will do is they will take it in there, they'll scan the wristband, yeah, and then they will scan the strip. So before you open up the strip, because they're individually packaged, so they would scan the strip, and that enters the information into the glucometer. Okay, then you take the strip out and put it in there. That's done every time. Okay, so some of these tests may be done each time. Check this code every time. Like down at the bottom, the coded glucometer, the strip has to match what's in the glucometer, because when you do the test up above, it stores data in there on what kind of strip it is. You understand what I'm saying? Okay. So it's coded with that particular stock of strip. So each time that you draw the blood, you have to make sure that everything matches. Make sense? Okay, so that's also good. Like you're going to draw blood glucose. How often do you that you confirm that the test strips are correct, and that will be each time, right? You do the control once per shift. So if you've got a 12-hour shift, and you do that at the beginning of your shift, you document it that you did the control. There's a book that goes along with it, and some of them are completely electronic, where you just plug your employee number into the glucometer, and it stores it. The real new ones have docking stations where you take that glucometer and you put them in this docking station, and it sends the results back to the lab. Okay, so they can sort of control that as well. Okay. Hang in there with me, we're almost done. Anyway, pre-analytical errors, these are just errors that human errors, right? So these are things that you would do to mess up the results of the specimen. So you didn't. You have to allow the alcohol to dry. You didn't use the appropriate gauge needle. The hematoma. So you can run through there. These are ways to prevent these pre-analytical errors. Okay, you don't want to avoid shaking the collection. Okay, you want to invert them, but not shaking. Drawing. If you're drawing out from a syringe, you pull too much on the syringe. Don't freeze the specimens, right? For sure. Tubes have expired. You forgot that on the wing tip. Put back a picture here. 2 pictures. See this wing tip? See this tubing? Mm-hmm. It's like an IV tubing, right? There's air in there. So you want to make sure that you purge that air out. Okay? So do that as well. Make sure that when you're doing your specimen that you're using the right antiseptic that the procedure calls for. And so do that again. Know the vocabulary. Right, very important. You'd hate to fail the test because you didn't know vocabulary words.
So whenever we're doing like error examples, like it says that like certain errors could be done, like if a girl like in the menstrual cycle, or like these certain medications, can that alter the test?
Yeah. Yeah, so you would document that. Like patients on their menstrual cycle, you would document that because there would be blood in the urine.
So it will be like something.
Well, they need to know. All of a sudden because the lab tech, without that information, all they know is that there's blood in the urine, so they'll report that back. So you would need to document that. Okay, patient's on menstrual cycle, they'll look at that and say, okay, that's why there's blood in the urine. Order draw, you need to memorize that. Put a star by that. Then you make sure that you do the correct order draw. And then the last thing it gets into, because we've already sort of talked about, you guys have taken drug testing, so you're familiar with that. If you're in athletics or UIL, you still take drug testing, okay? Random drug test. So you go and, you have to do the drug test by themselves. The person doing the test should be in there with you, unless you're in there by yourself. Here they clear the restroom out, they send the person in to do the drug test because there's only one person in there, and they put that blue stuff in the water so you can't get. There's all kinds of stuff that people try to do for urine drug test, okay? They measure the temperature when it comes out. It has to be body temperature. They have a little laser thing they lace the cup with, and the temperature comes out. If you're in forensics, if you like that, and you're doing forensic swabs or something, remember that's crime, okay? So they're probably picking that up for some sort of crime, and so you have to be very careful, especially with the chain of custody, because the lawyers, the defense lawyers, are looking for loopholes. They probably already know that their client's guilty. Okay, they know that. Okay, so a lot of defense lawyers, they just look for loopholes. I'm not saying everybody's guilty, right? But if you go to trial, that person goes to trial, more than likely they're guilty. Okay? Because a lot of times they just want to, most of the time they figure it out before then, okay? And they're going to trial to see if they can just find some sort of loophole. Nobody goes to trial. I wouldn't want to go to trial by jury. I would just let the judge make the decision. At least they're in law, right? The jury are a bunch of bleeding heart people they pick off the street that they can manipulate.
Is that what they call jury duty?
Yeah. I would never go to, if I did something in trial by jury, I'll just let the judge make the decision. Okay, hear the case and make the decision. Huh?
You can choose that?
Oh yeah. Because people can be manipulated. That's why you don't see a lot of medical people actually on juries. One, they're sort of an A-type personality, and they're really opinionated, so they don't work out well on juries. That's how I get off. When I get my summons for jury duty, I said it. Hope I don't get one. You write your vocation down there, and I always put paramedic. I never put teacher. I put paramedic. They get that because the lawyers look at that. They look at those, and when you go in, they sit in a certain seat, right? Well, you haven't done it, but if you get pulled, you get selected for the first stage of it. They seat you in a numbered seat. So let's say I'm going in, I'm sitting in seat number 2. All right, they have my card. The last one I was on was a DWI, and I sit down, and they say, okay, who has any connection with anybody involved in a DWI? So people raise their hand. I raise my hand, and the defense attorney looked over at me and goes, "You're the paramedic, right?" I'm like, "Yeah." "Go last. I'm going to ask you last." So everybody answered, "Yeah, my brother was killed by a drunk driver." "Okay, you're dismissed," or whatever the case may be. And they go, they got to me and they look at me and they said, "What is your connection with DWIs?" And I said, "I deal with the victims." And they look at me and goes, "You're dismissed." Because they were defending somebody that was convicted or being convicted of DWI, right? this is funny, but they asked me right before that, they go, do you think that the person that is being on trial for DWI, do you think that they could actually tell the truth?
No.
Yeah, that's what I said. No, they're gonna lie. They're gonna lie to get out of it. And they're like, you're done. Like, exactly. Anyway, look over this, okay, and sort of go through. It requires sort of a constant review and reading and then work on the quizzes and stuff. As time goes on, we're gonna give you that time too. But do read through, highlight, right? Work the quizzes, keep this stuff in mind. I think it's pretty basic, right? It's pretty basic to understand. Yeah.
Quick question.